Good afternoon and good morning to those of you joining us from out west. I'm Karen Langdon with the National Emergency Management Association, and on behalf of NEMA and the Center for Homeland Defense and Security at NPS, I'd like to welcome you to the webinar today, Non-Traditional Authorities in COVID-19 Response. Thank you again for being with us today, and now it's my pleasure to introduce our moderator, NEMA past president and current director of the Center for Homeland Defense and Security, Glen Woodbury. Glen?
Great, thank you, Karen. Welcome, everyone. We're really happy to have you join us. A couple of things before I introduce the panelists. First of all, we're really happy with this partnership with National Emergency Management Association, a longstanding partnership, and we're hoping we can provide you the knowledge and expertise and experiences that we have. And that's kind of the objective here, is to provide as much information as we have available. We may not be able to answer every question, and maybe there aren't answers to every question, but the idea here is to at least lay a foundation, at least around these three broad authorities and our current understandings, and we'll see where it goes from there. The way we're going to do this, I'll introduce the panelists briefly. The panelists will do some short remarks, 5 to 10 minutes, and then we'll go to a Q&A. So our speakers today, I'd like to welcome Mary Catherine Ott, also MC Ott, who's the Legislative Director of the Homeland Security and Policy Safety Committee at the National Governors Association. Paul Rosenzweig, one of our SMEs. Paul is also the former Deputy Assistant Secretary for Policy at DHS. Eileen Decker, one of our subject matter experts as well. She's the former U.S. Assistant Attorney Deputy Mayor of Los Angeles. Really pleased to have Sarah Summers, who's the Managing Attorney at the National Health Law Program, Southeastern Region Network for Public Health Law. Bill Carwile, former Associate Administrator, Response and Recovery at FEMA, also one of our faculty here at the center. And David Fukutomi, also one of our faculty here and running Deputy Associate Director of our Executive Education Programs. We don't want to take too much time with bios. You have a copy of them. So let's just get started. MC, the floor is yours.
Great, thanks. And thank you so much. I am impressed by the panel that you've put together and feel a little intimidated by the folks who I'm speaking with, but appreciate the outreach to the National Governors Association on this critical time. As you all can imagine, it's unprecedented for all of us. It's unprecedented for governors across the country, and as they're looking to address this crisis. And in that vein, there's a lot of things innovative being done, and kind of as we're talking about these unconventional authorities, I think our response to the COVID-19 has been very much unconventional. So I just want to kind of lay a little bit of a groundwork from what we're seeing across the board. You all have probably seen that governors really are at the center of this crisis. A lot of people are looking to governors in terms of their response at the local level, be it stay-at-home orders or if it's procurement of PPE and ventilators. We've really seen that focused in lens across the country on my membership. So for us, really the challenges associated with procurement of PPE and critical medical resources is the fundamental challenge I think we're all seeing right now. The governors have been pretty articulate in terms of the challenges of the open market, not really knowing how to really compete for critical resources, concerns about competing with both the federal government as well as with one another, which obviously in a crisis scenario is not optimal. So really we've been leveraging NGA and really working together across all of our various divisions to try to provide the best resources to address these sort of concerns for governors. And as part of that, there have been two kind of efforts on a weekly basis. One, governors have been meeting and sitting via teleconference with the vice president, and on occasion the president during a teleconference. The president and vice president have been very much listening and addressing significant concerns that the governors have been raising at these meetings. And really the top 5 asks that we've seen for the past week or two for these calls, for those top asks really deal with some of these authorities and the execution of them. So first and foremost, really looking at dedicated funding and asking that 50% of the federal funding coming to states is dedicated to states. The funding coming from Congress is dedicated to states and helping with waivers and expediting and flexibility. So right now, as you all probably know, Congress has just released their 3rd supplemental appropriation package along with some legislative provisions, and that accounts for about $2 trillion in total of the discretionary funding right there. It's reported that about 80% of the $330 billion in discretionary funds is being dedicated to states. So that just goes to show this is critically important. Both Congress and the administration are finding ways to expedite that funding for the needs across the board. As part of that, that increase to access of PPE, masks, test kits, extraction kits, and accelerating the production of life-saving equipment such as ventilators has been another big ask from governors. As part of that, we are obviously going to be talking about the Defense Production Act today on that. And from an NGA perspective, I look forward to that conversation. It's a complicated authority that exists in the federal government, and we are working with our members to really figure out what the right levers are. So I look forward to that discussion on this panel shortly. Additionally, we are asking for a clarity from HHS in terms of how that might be executed. And one other big big point on kind of what government in this sort of space is how to better utilize their National Guard. So there's some intricacies of statuses you can use your National Guard on, and one is Title 32, which is a state-federal kind of nexus of it's federally paid in benefits, but it's command and control of the governor. So the governors have been asking for that. So really, it's great to see the administration's willingness to work with governors to find and expedite areas where we can find waivers, we can find flexibility, and ensure that the response is timely and necessary for what the people need to respond to this crisis. With Congress, it's been very similar. We've really been, our leadership, our Chair, Governor Hogan, especially our Vice Chair, Governor Cuomo, have really been very articulate with Congress about these additional needs, asking for that money to states and some flexibility because every challenge is different, every need is different across the states. So as I mentioned already, that stimulus package showing that is very productive and helpful, which hopefully will trickle down for all the folks here on this call and across the country. And then working together, the governors are really coming together. They are a great peer group. We always say when they come together at their 2 annual conferences, they're just a bunch of friends. You can't tell politics at any given point. So NGA has been helping to facilitate individual calls with the group of governors themselves, no outside participants. They had a call today, and that's really their opportunity to come together and talk about the needs across the nation and how to best articulate it both to Congress and the administration as I laid out here. And so I just kind of want to wrap up and reemphasizing this whole unprecedented scenario. It's from an NGA perspective, all of us staff are all hands on deck. We are providing the information across the board to all the policy advisors, be it the emergency managers, Homeland Security advisors, health policy advisors, legal counsels. We've been talking about designation of essential employees in the past week. So we really are trying to be that strong advocate both on the federal side and sharing of information on the state side. So with that, I'll kind of wrap up and hand it back over to our moderator.
Thanks very much, MC. Paul, why don't you go ahead?
Great. Thanks for having me on. If you could go to the next slide, Karen. That's me, now that you know who I am. I am going to be talking with you today for about 5 to 10 minutes about the National Emergencies Act, which is a kind of overarching act that provides structure within which the federal government can organize its own response to COVID-19. The reality is that for many, many years, much of our history, the presidents of our country asserted essentially an unlimited power to declare emergencies and act within the domestic United States without much, if anything, in the way of congressional oversight. And for a large fraction of our history, that worked out pretty well. Most of our presidential emergency declarations were ones that you would have expected and seemed justified. President Roosevelt declared an emergency in World War II, President Truman in the Korean War, for example. Other declarations of emergencies might or might not have been fully consistent with what we all thought, what we might think of as an emergency, akin to what we're experiencing today with COVID-19. In 1971, the president declared a national emergency to fight inflation. And that was met with a bit of skepticism, I would say, by Congress and the American public. It didn't seem like a reasonable use of executive authority. And so in 1976, Congress passed a law, the National Emergencies Act, which is codified now in Title 50 of the U.S. Code to give structure to the declaration of new emergencies. It's not totally uncommon. It's been used 60 plus times since the 1970s, so it isn't restricted to times of war or times of extreme crisis like now. We declared a national emergency, for example, in the Iranian crisis with the hostage taking that happened there. Essentially, what that law does now is provide a structure for how the president may declare emergencies and requires him to provide updates to Congress about what he's doing and related expenditures. What I would tell you at the most basic level is this: when a president declares a national emergency, that doesn't bring with it the right to use all of the contingent emergency powers that the president has. The main structural requirement here is that as a president declares a particular national emergency, he also specifies which contingent emergency powers that are in statute are the ones he's going to invoke. For example, as we sit here today, the president has declared a national emergency about COVID-19. He did so on March 13th, 2020. But the only thing he did in that declaration was invoke one specific type of emergency authority, that is the authority of the Secretary of HHS to waive Section 1135 of the Social Security Act. We're going to hear more about that later from somebody who knows a lot more about the Social Security Act than I do, but he didn't invoke a whole host of other possible powers that he might have chosen to do had he wished to. Now, the other thing you have to know about this law is that when it was originally adopted, it was adopted in 1976 with the provision that Congress could negate the president's emergency power by exercising what was then called a one-chamber veto. If one House of Congress chose to reject the president's declaration, it would be dead. The U.S. Supreme Court has since said that that type of veto of executive action is unconstitutional. So today, the only way to end a national emergency declaration is either for the president to rescind it because he thinks the emergency has passed, or for the two houses of Congress to pass a joint resolution, in effect a law terminating the emergency, and if they wish to, if they have to, overriding a president's veto of that. So as we sit here today, there are in fact 34 such declarations in effect, including the one that we've spoken about with respect to COVID-19. There's an existing one from 2001 that relates to 9/11 terrorism. There's one from sanctions for election interference that is against Russia, and so on. If you could go forward to the next slide, Karen, please. I'll put a little more detail onto this. Essentially, one way of thinking about this is that this is a multiple choice Stafford Act for the federal government. When the president invokes the National Emergencies Act, he can pick and choose which of the contingent authorities he has he's going to use. There are, in fact, more than 130 out there that can be invoked at any one time. Some, for example, might be applicable today. The Secretary of HHS, for example, has a contingent authority to authorize us to use unapproved drugs for combating a pandemic. The president has not yet invoked the National Emergencies Act with respect to that authority, so that authority is contingent. But at some point down the road, if the president were, for example, wanting to expedite the distribution of a new vaccine and short-circuit testing at the FDA, he could authorize that. There are also lots of fund transfer authorities. We've seen the president invoke that recently for things like building the border wall, an authority I know was somewhat controversial, but leaving aside the controversy, there are lots of pots of money that a president can tap and access to if he chooses to invoke this emergency authority. Again, thus far, President Trump has not done so. There are a few provisions of law that allow governors to petition the U.S. government in time of emergency to waive restrictions. For example, waiving Clean Air Act requirements. There aren't a lot of those, though, so there isn't a lot of room for governors to play in this space directly. Some of these authorities are really, really broad authorities that are almost shocking in the breadth of what a president can do. The president can stop the export of oil for up to a year from this country simply by declaring an emergency and ordering the Secretary of Commerce to do that. That's a pretty stringent set of authorities that we've given to our president to exercise in time of emergency. But there are also some real gaps. And the most notable one of those that is relevant to our discussion today is that there is no statutory authority that the president can invoke under the National Emergencies Act in order to order a nationwide quarantine or shutdown or stay-at-home order or whatever you want to call it. That authority simply doesn't exist statutorily, and so the National Emergencies Act is not a way for example, the president to get everybody to go back to work if he wanted to, or conversely, to get everybody to stop going to work if he chose to do that. So essentially, the 130 different waiver authorities are a patchwork. Some are very strong, some are very weak, some are broad, some are not. And the last thing I would leave you with is that in the recent litigation over the border wall funding, what we've pretty much learned is that just as Congress doesn't have much of a role to play unless it wants to override the president's decision with a veto-proof majority, the courts are extremely deferential to national emergency declarations. The most recent of which, the border funding decision that I talked about earlier, resulted in the Supreme Court permitting the president to reprogram funds to fund the border wall, notwithstanding the fact that many might have said that this wasn't a true national emergency. So with that kind of basic introduction, I'll toss it back to you, Glenn, and wait for questions in the Q&A.
Great, thanks very much, Paul. Eileen?
Hello, good morning from Los Angeles, and our great thanks for all the work you are doing out in the field. Today, I intend to cover the Defense Production Act, and in regard to that, cover a few areas, specifically the history, key significant provisions of the Act, how it's been used in the past, and the current executive order. So if we could go to the next slide, Karen. With respect to the history, just very briefly, many people, when they think about the Defense Production Act, especially in the last few weeks since it's been signed, think about World War II and what the government did at that time. It is, in fact, inspired by the First and Second War Powers Act of 1941-42, where the government was given great and very broad authority to regulate industry during the war. And it's commonly cited, and people reflect upon the making of bombers, tanks, and other equipment necessary for the national war effort. But much of that authority, in fact, expired after World War II. But with the Cold War in the 1940s and then the North Korean invasion of South Korea in 1950, the Truman administration sought and obtained anew this very powerful executive authority, which continues to this day, although in a significantly modified form from its original prescription. But it has now a focus much more on what is in the interest of national security. But as it was enacted in 1950, it had very broad authority, priority to defense production, the requisition of materials and property, the expansion of production capacity, the rationing of consumer goods, the fixing of wages and price ceilings, settlement of labor disputes, and consumer credit controls. And my personal favorite provision that has since expired is the voluntary reserve of private sector executives who would be available for emergency federal employment. But as I said, many of these provisions expired. They lapsed over time. Some were renewed by Congress. Those that lapsed have to do largely with the labor and consumer, more in the economic policy provisions have expired. And over time, it became more focused on what is considered the national defense, less so on the economy, more on national defense. And I say this even though one of its primary features and aims of this act is that the government essentially guarantees a market for the production of all the goods when it is invoked. But that said, there were expansions over the years as well, and particularly in the definition of what is the national defense to include critical infrastructure, homeland security. We'll get to that in a moment. As I mentioned earlier, it has sunset provisions. It is renewed periodically. In fact, it's been renewed over 50 times since enacted, last authorized as part of the John McCain National Defense Authorization Act in 2018, and its current provisions will expire on September 30th, 2025. Three of the 7 original provisions continue to this day. I'll get to those in more detail, but they are in sum the authority to set priorities and allocate resources, loan guarantees or financial incentives, and then the authorities on how it will be used, how it will be implemented. If we could go to the next slide, please. Generally, the DPA provides the president with this broad authority as long as the president's actions are deemed needed or essential for the national defense. And in that, this means that the actions being taken by the president must be tied to promoting, supporting, or deemed essential to the national defense. Next slide, please. And on this next slide, you will see the statutory definition of national defense in the DPA. And it includes things like critical infrastructure of any foreign nation, homeland security, and emergency preparedness activities under the Stafford Act. And the next slide is the provision of the Stafford Act that is referenced. And here, key for our purposes is the definition of emergency preparedness, meaning the minimization of the effect of a hazard on the civilian population. The overall objective here is to ensure that the domestic industrial base is mobilized, prepared to support the national defense, both during national emergencies and in peacetime. And given the breadth of national defense activities, the DPA can apply to a wide variety of companies providing goods and services deemed essential to the national interest. The authorities are all given to the President of the United States under this act, who then can delegate these authorities to department heads, as has recently happened through executive orders. And there are several executive orders that I'll get to shortly. So those are the circumstances or the background necessary that allows a president to exercise authority. Now let's focus, if we can go to the next slide, on what those authorities are. And as I said, 3 of the 7 titles are left now in the statute. Fundamentally, the president can set priorities and the allocation of resources, provide loan guarantees, direct loans, and can also, the final title left is how those authorities will be used. I will not spend much, if any, time on Title VII other than it can give preferences to small businesses. There's a mechanism for voluntary agreements between businesses that provides businesses some assurances that they're not going to violate antitrust laws. That gets into a lot of minutiae and detail on the procedures they have to follow, but I will not go down that path today. First, on the priorities and allocations. The statute in the Act requires the private sector to perform under contracts necessary to promote the national defense, of course. It allows the prioritization of government contracts over any other contract. It allows the allocation of materials, services, facilities to promote that effort to get those contracts complied with. It can include, in fact, getting the underlying materials necessary to produce goods. And persons and corporations can be required to accept those priority contracts. There are some certain exceptions that I think would not be as relevant to this particular conversations. But the government can also establish priorities between government contracts. The prioritization of contracts is done actually very frequently, largely by the Department of Defense regarding different materials and services, facilities it needs, setting priorities between their own contracts. It's used historically less by other departments, but it has been used by many other departments, particularly in times of emergency. The FBI has used contract priority provisions here to support the development of the Terrorist Screening Center. It has been used after Hurricane Katrina. It's been used in Puerto Rico. It has used quite frequently, again, largely by the Department of Defense. Title III, that provides loan guarantees and direct loans, again, is its overall aim, similar to Title I and all the three titles here, is aimed at ensuring the nation has an adequate supply of resources and ability to produce what is needed for the national defense. So it provides financial incentives to develop and maintain modernized equipment, expand production capacity for critical components. And so the government here can use loan guarantees and direct loans to reduce those shortfalls and encourage and help private industry to meet the needs of the nation. So to summarize an emergency, in a national emergency, a president has the authority to establish rules, ensure a rapid response from domestic industry to meet the critical needs of the country. So for example, a president can direct an industry to focus on scarce and critical materials. Non-medical product manufacturers could be asked to shift production to medical supplies, or perhaps more likely, the components of a medical supply that is needed for other producers to succeed. The DPA authorizes the president to create, maintain, expand, and use all of these capabilities to purchase the underlying equipments, and can use a tremendous amount of financial incentives to achieve that. The DPA also, by the way, authorizes a president, upon determining it's in the interest of the national defense, to consult with industry business representatives to establish voluntary agreements as well, to assist the government in addressing the national defense, to expand production capacity. Voluntary, again, is about entering into these agreements so that businesses later can avoid any antitrust complaints that may come their way when they are collaborating with other businesses within their sector. I'll just point out this provision is different than businesses just voluntarily engaging in this activity. I think we're hearing all around the country about different businesses, whether it's Ford or here in Los Angeles, the Budweiser plant is making hand sanitizer now. Those are voluntary actions by those businesses as opposed to under DPA authority. So next slide, please. The current executive order, which I'll cover just to tie in what the act is and what is in the current executive order. This was issued by the president on March 18th, announcing he was invoking the DPA to allow the administration to marshal American industry to prioritize the production of medical supplies and pharmaceuticals that are in short supply. At the time he was invoking, the president did say, we have this just in case we need it. He did not say whether they'd be issuing additional orders pursuant to that authority. So what this order does is it makes some significant findings that the statute requires in order to invoke the DPA. Specifically, he found COVID-19 threatens to strain our national healthcare system, that the nation must have the ability to have that surge capacity to address the needs, the healthcare needs of our nation, that we must be able to respond promptly to stop the spread of the virus, and that critical health and medical resources are needed in order to respond and to be able to distribute them to the areas most in need. The order itself specifically identifies PPEs and ventilators. The Secretary of HHS said that PPEs here are considered protective gear for healthcare workers, masks, gloves, and other critical supplies. So in terms of complying with the act, the order specifically makes some findings, specifically that there's a critical need for strategic materials that are scarce and essential, and the need for these materials are necessary to achieve the national defense, and that they cannot, our national defense needs cannot be met without creating a significant dislocation of the normal distribution of the material in the civilian market. He delegates to the Secretary of HHS the ability to identify the specific health and medical resources needs to meet the strategic requirements of our country. And so at any time, in theory, the HHS secretary can now invoke the order to ensure the performance of contracts, can set priorities in which contracts come first and need to be complied with. The HHS secretary can set the nationwide priorities to allocate materials as necessary and appropriate. Although at this time, based on my research, there have not been the issuance of any regulations on the prioritization of contracts, resources, distribution plans, or other specifics under the executive order. There is another related executive order that is referenced in the March executive order, and that is the one 13603 that was issued in March of 2012 by President Obama. This is largely an implementation executive order so that all subsequent executive orders don't have to go into the details on a lot of delegation of authorities that the Act requires. So I think that is where we stand today. And with that, back to you, Glenn or Sarah.
Great. Thanks very much, Eileen. I'm sure there's going to be plenty of questions. I have several. Sarah, why don't you take us to the next?
Thanks very much. I'm Sarah Summers. I am a managing attorney at the National Health Law Program, and I'm also part of the Southeastern region of the Network for Public Health Law. And so I was asked to join to talk about what are known as Section 1135 waivers after Section 1135 of the Social Security Act. And this authorizes the Secretary of Health and Human Services to temporarily modify or waive Medicare, Medicaid, children's health insurance programs, or HIPAA requirements. What this is intended to do is to make sure that healthcare services are available to meet the needs of everybody who are enrolled in Social Security Act programs, Medicaid, Medicare, CHIP, and other programs when an emergency is experienced. In common with the rest of the issues we're talking about here, you need a declaration of national emergency or disaster, and a public health emergency determination in addition by the HHS secretary. And what Section 1135 does is it's meant to smooth the way around what under normal circumstances are really necessary safeguards and processes in order to ensure that Medicaid and Medicare services are being provided in a way that's consistent with the law and is an efficient expenditure of money. The typical 1135 waivers are generally focused on conditions of provider participation or other certification requirements under the various federal programs. It can also waive licensure requirements to enable healthcare providers who are licensed in one state to practice in another. To be clear, that is only about the federal barriers. That doesn't override state licensure requirements, but it can smooth the way in some situations when it's a Medicare provision that's a barrier. It also allows states to waive prior authorization and other pre-approval requirements to expedite the provision of services. It, under limited circumstances, allows states to get around the Emergency Medical Treatment and Labor Act, known as EMTLA, which requires stabilization before a patient can be transferred from one facility to another, intended to avoid patient dumping. But this allows that to be overridden when there's a pandemic or epidemic in other way. There are also, it allows for states to apply for specific waivers. In addition, it also provides for blanket, for the federal government to issue blanket waivers. And the federal government, under these circumstances, has done that. For just across the board, for example, states no longer have to comply with a requirement that you need a 3-day hospitalization before Medicare will cover a skilled nursing facility stay. That's, obviously necessary under circumstances when people could very rapidly get seriously ill. It also waives the requirements that critical access hospitals limit the number of beds to 25, and that a length of stay be limited to only 96 hours. The number of beds can be exceeded, and the length of the stay can be exceeded. This is a rapidly moving area. Just within the last couple of days, 15 states have been granted 1135 waivers under the Medicaid program. And at the end of yesterday, 3 more were approved. So we anticipate more will be approved in the next, over the coming hours and days. Most of the states are waiving provisions related to conditions of participation and also certain certification requirements for people who are going into nursing homes. Some states have stepped beyond the obvious prescribed waivers and have asked that beneficiaries have a longer time to apply for fair hearings when they've been denied services, or to skip an internal Medicaid managed care hearing. This is something that has come about generally on a more regional basis in recent years. For example, under Hurricanes Dorian, Hurricane Harvey, there were regional 1135 waivers for the states that were most directly affected there. And again, under the H1N1 pandemic, there were also more targeted waivers. This is something where theoretically every state could actually have one. They all ultimately will likely be eligible for it. So I will leave it at that. And if people have questions later, I am happy to answer them.
Excellent. Thanks very much, Sarah. Let's go to Bill Carwile. And Bill, if it's not part of your planned comments, if you would think of talking to how should DPA be used and resources are manufactured, what's the process for a state or locality, I guess, getting access to it? Is that handled through the normal resource allocation methods within the Stafford Act or some other process?
Yeah, Glenn, thank you. Yeah, we'll touch on that a bit. Yeah, I probably learned more about the Defense Production Act in the last 10 days or so than I ever did when I was an FCO on big disasters out in the field, or Director of Disaster Operations at FEMA headquarters running the NRCC. And the disasters in which we either considered using Title I of the DPA or actually did or didn't, there was one common denominator. And big disasters, there simply isn't enough stuff to meet all the requirements. This is one of the major differences that we have to deal with. And with COVID-19, of course, this is true to a degree we've never experienced before. That's what makes it a big challenge, is in how you manage these shortfalls. Now, back in 1998, during Hurricane George, I had to be the FCO down in the Cat 4 event in Puerto Rico, Hurricane George. We were desperate for generators and plastic sheeting and roofs. We coordinated with headquarters and using Title I, and we never went into the other titles that I know of. We were able to get a priority on generators and plastic sheetings for the Blue Roof program, which were critical down there. In 2004, in the 4 hurricanes that struck Florida, when I was with the FCO with Craig and Governor Bush, Title I was considered again for plastic sheeting for blue roofs. And Hurricane Katrina, as Eileen said, that in 2005, I was the FCO with Robert Latham and Governor Barber over in Mississippi. But in Louisiana, Title I was used to assign a DPA priority rating for switching gear for the railroad. I think it's Norfolk Southern. Anyway, it's reduced their operational hold from 90 to 10 days. 2012, when I was at headquarters during Hurricane Sandy, we looked at Title I of the DPA for home repair materials, especially for the New York, New Jersey area, trying to get folks back on their homes. I'm told in 2017, the hurricane season, the costliest of record, as we'll recall, Hurricanes Harvey, Irma, Maria, there were 1,200 priority ratings under Title I were placed. I know in Texas, for Hurricane Harvey, lodging was granted the priority based on a request from Texas. One thing I learned about DPA, though, it didn't provide a silver bullet. We're still faced with managing shortages and having to set priorities. Also, achieving unity of effort and accounting for all those materials that came in was a major challenge. And I know that's being done all over the country right now, perhaps in different ways. I know here in the state of Oregon, my friend Andrew Phelps and Governor Brown on a presser the other day mentioned they're using the state all hazards plan, tailored for the COVID-19 and the unified command that they normally use, plus the additional people that are expertise that are required for this kind of a health emergency. My personal experiences in Hurricane Katrina in Mississippi under Governor Barbour, the best example I could see to achieve both unity of effort and accessing resources, because we were in competition with the state of Louisiana. We found out that priorities tend to follow the CNN cameras sometimes. And one of the things we found out was to be able to get those priorities, the best was to be able to articulate what those priorities would do for us and really make a difference, rather than saying we need 1,000 manufactured homes. And I think we put in over 33,000 in about a 4 to 6 month period. What were those going to actually do for us? Because we know we're in competition with our friends over to the west. But in practical terms, Glenn, your question, when those requests come up from the states through the normal, challenges, the normal channels to headquarters, headquarters will look around for, and somebody's on from FEMA can let me know if they're doing something differently now, and they'll go to the usual providers, to the emergency support function, or to logistics, to contracting. And if those materials aren't out there, then the consideration will be given at that level to invoking the DPA. Again, I'm only familiar with using Title I of the Defense Production Act, and on those procurement actions, make sure that those include the fact that this is under the Title I of the Defense Production Act, just like happened in Louisiana during Hurricane Katrina. And then those folks who made the switching gear that the railroad needed, they put that railroad at the top of the queue. Now, sometimes, again, an example on Hurricane Katrina, the state of Texas had several things that they knew were in short supply, to include lodging. They requested through the Joint Field Office with the state coordinating officer and the federal coordinating officer up to headquarters for DPA Title I to be issued for lodging, so they could set a priority for survivors of the disaster. So I guess it can come from two ways: up from the states, or within the NRCC when it's determined that those resources aren't readily available through the normal channels. And the other thing is that sometimes those resources may not be they may be the solution set that we almost always use in smaller disasters, but hopefully within both the joint field offices and the NRCC, people are looking for creative ways to meet the needs, which may not include that normal resource that would be used in smaller disasters, but just isn't available. So there may be some questions on that later, or somebody from FEMA may talk about how they're doing that right now. Hopefully, Glenn, that kind of addressed your question.
Yes, thank you very much, Bill. David, why don't you give some comments, and then we'll go to Q&A.
Sure. I'm just going to quickly summarize a couple of things. I think Paul mentioned the NEA is kind of the Federal Stafford Act. So aside from any specific mentions in there about invoking federal authority, all other requests to invoke federal acts, including the Stafford Act, need to still be made specifically, particularly as it relates to a major disaster declaration. Eileen mentioned some very good points about DPA. The key thing, it's been used for very specific situations, and the focus is to leverage capacity and help set priority. But I think it's important that in both the NEA and the DPA is that unless there are waivers granted in writing in the invocation of those acts or those declarations, there's oftentimes a false assumption made that there's blanket waivers for all kinds of things. So it's really important to look at the details of those declarations, and then the states still need to make specific requests for waivers that are beyond that. On Sarah's points, I think, I serve on the board of a regional healthcare system. The 1135 waivers are a big deal for healthcare systems, healthcare providers, and hospitals that receive a lot of Medicare and Medicaid patients, particularly rural ones. And so to the extent that you're hearing from your constituents in those areas, this is a really big deal. And again, there's some misunderstanding that this only applies, as Sarah mentioned, to any waivers applies to federal standards. State and local requirements are still in effect. I just add just a couple of closing comments. Again, I think when the important things about making any request for a waiver is that you need to be specific to what it is you're asking for. And oftentimes we don't give the benefit of the doubt to the person next up, whether it be a federal agency or a local government to a state agency, that the folks you're dealing with can't possibly know everything about your situation, certainly not like you do. So we need to give the folks the benefit of the doubt and be very specific in our request about painting the situation, articulating situational awareness, what actions have been taken by your mayor or your governor, what the situation is, statistics, what's critical and what's not, and then be very descriptive in terms of what's being asked for. The states that are used to requesting major disaster declarations know this drill. They always get asked for more information. That's really important, particularly in times like this. When requesting resources, be specific about the challenge that you're trying to solve and what the outcome is. Don't just ask for a specific resource. The famous example is somebody always asking for a Black Hawk from the National Guard or the military when they want to transport 10 passengers from point A to point B. It's really important to articulate what your requirement is and what the mission that you're trying to support. With that, we'll be available to answer any questions. Back to Glenn.
Great. Thanks, David. Thanks to everyone. Are you aware of any states and governors requesting additional production short of, or I guess, I won't say short of, but absent or alternatively to the DPA? Are states already working out with industry to try and get critical requirements met? Eileen, we talked about this a little bit yesterday. As far as the DPA goes, there's nothing that prohibits a governor or a mayor or a county commissioner from reaching out to industry to produce additional resources, is there?
No, there's nothing that prohibits governors and mayors from doing it. In fact, I can say here in Los Angeles, Mayor Garcetti has put together a task force of business leaders whose job it is to work within a task force environment that includes hospitals, medical practitioners, and law enforcement to identify the needs and then to reach out to the business community to ask for their assistance. So, for example, I brought up earlier the example of here in Los Angeles that the Budweiser plant we have here in LA, which emits a wonderful odor as you drive through the valley, by the way, has shifted its production from the production of beer to hand sanitizer. And what we're finding is that they're very fast, very efficient. It does feel a little different. People have to get used to it. But it's been very successful, and Budweiser is feeling quite happy and satisfied that they are contributing to a local and, in fact, a national effort voluntarily. So there's nothing that prohibits that. The issue is, what is the overall demand in the country and within the states, and are enough businesses being asked to address the more national need? So yes, governors and mayors can engage the private sector, get voluntary compliance. The only problem with that is that they're running a little bit blind onto what the broader needs are.
Okay, thank you. And following up on that, this may be a question to Bill or David. So if it's a 75-25 cost share and you receive something that's produced through the DPA authority, does that change the cost share at all, or is the state still responsible for a 25% cost of whatever that DPA produced item was?
Glenn, this is David. So if the if the state made a request for a resource from FEMA, whether it be surgical masks or sandbags, anything FEMA provided normally under the Stafford Act would still be subject to those cost share waivers. The difference would be is if that DPA provided or sourced item was provided directly, say, to a healthcare system or a hospital, that would be subject to whatever requirement or whatever contracting arrangements that the hospital had with the manufacturer, perhaps. Just the fact that the DPA helped expedite that didn't necessarily put it under Stafford. But if it's under Stafford, current understanding is that it'd still be subject to cost share.
Yeah, Glenn, this is Bill. That's my understanding as well.
Okay. We have a question here on the, I think it's the National Emergency Act. So Paul, rather than, these are some sensitive questions at times, but let me just ask this. There was a question about the closing or opening of businesses under a national emergency, or is it under a national emergency? Does a president have an authority to open businesses or close businesses under the NEA?
Well, that's a great question. Let's kind of walk our way through it. First off, presidents have immense advocacy, right? So he doesn't have, even if he doesn't have any authority, a president saying aloud, I really think that restaurants should close, or alternatively, I really think Americans should go back to work and start going back to restaurants for the economy, that has a powerful effect on members of the public. But with respect to state orders, can the president order, say, state and local authorities to change their policies? The answer is no. The Supreme Court said that in a case called New York versus United States and another one called Prince versus United States. Federal governments don't have the authority to order a governor to do something. They could override a state law with a federal law that gave them supreme authority, but there is no such law right now that gives the president closure authority for particular businesses. There are some rare exceptions to that. For example, the president might be able to nationalize the telecommunications system in time of emergency in order to broadcast his message, but there is no provision, for example, that allows him to nationalize and then shut down the theaters or the restaurants as well. And then finally, there is one other tool a president would have that might be useful if he wanted to, and I wouldn't advocate doing this, but if Congress passed a law that conditioned receiving federal money on states taking certain actions, there's a way in which the federal government could effectively coerce states into doing what it wants it to do without having the authority to actually force it to do so. Does that answer the question?
Yeah, I think it does. Thank you very much, Paul. Marco, good to hear from you. I'm not sure we can answer the first. I agree on bringing in certainly expertise who have been working on these issues for some time. I don't know if we're in a place where we can answer about how currently, how HHS and FEMA are currently coordinating on these authorities or not. I would rely or ask FEMA maybe to follow up on that answer. We don't have the expertise, I don't think, right here to answer that affirmatively one way or another. David and Bill, there are a couple of questions asking about IA, HMGP, and cost shares. I don't know if you can see those, but one is, what is the rationale for having individual states ask for declarations? Is it just for IA and possibly HMGP? I know we're going into more of the Stafford Act type of area as opposed to the three acts we initially talked. But any thoughts on that?
Well, first I would say if the questions are from the states, that obviously they should work with their FEMA regions, and if they're local jurisdictions, work through a state emergency management organization. But in general, I'd say I don't know if this addresses the question, but the current declaration is only the emergency declaration authority under the Stafford Act, which really only provides two things. That's direct federal assistance, resource requests, or federal assets, and reimbursement for under public assistance program category B, which is emergency protective measures. So anything beyond that, whether it be for a major disaster declaration or any of the specific programs available under the Stafford Act, need to be made or requested just like you would any other type of for disaster declaration through the formal declaration process.
Okay, I understand.
Yeah, Glen, this is Bill. I think a couple of states have, because the original declaration allowed for states to come in for majors later. I think at least 2 states have come in for those, and one of which may have asked for HMDP. But I think they would, when they went in for a major, they would ask for the various categories that are eligible under a major, and they would be dealt with independently based on the, and David's right, and I'm sure the states will be working with their regions on those kind of requests.
Understand. In looking at some more questions from both Deborah and Viviana, I don't want to put those off. I'm wondering if we want to maybe hold another webinar just specifically to Stafford Act type of questions. I think those are all very valid. A question for Paul. Does the NEA, would a national quarantine fall under the NEA? You kind of touched on that before. Is that something that Congress might do? Should we get to that?
Again, the NEA activates a whole host of contingent authorities that have already been enacted into law. Laws that say things like, in the case of a national emergency, the president may enable waivers of Section 1135 of the Social Security Act. There is no such contingent quarantine authority on the books today. So if the president were to declare a national emergency and order a national quarantine, he would be doing so not under statute, but under his, what he would purport to call his inherent authority as chief executive of the United States. The Supreme Court, in a case from the 1950s, long ago held that presidents don't really have that authority, and that and in a case from the 1900s said that states are the ones that have the general police power and the public health authority. There could be a fight, and to be honest with you, predicting what a court might say today in the face of this giant emergency is risky. Courts might make an exception in order to save millions of lives, and who could blame them? But as a strict matter of law, right now, my estimate is that the president does not have such authority. He has the authority to ask all the governors to do that. He has the authority to say that he will withhold money from them if they don't do that. But he can't directly tell people that they must stay home across the United States. My opinion.
Okay, thanks, Paul. Marco offered an answer to a previous question, and so I want to run this by Bill and David as well. So Marco said that the answer to the question of what states need to purchase either under DPA authority or outside of it has a cost share impact only if the state files under Cap B for reimbursement, which would then force the cost share. If states use other funds to pay for the product, then the cost share rule would not apply. David, Bill, you agree with that?
Yeah, this is Bill. Yeah, I agree with that. So all those costs, I think David earlier, all those costs under Category B would be at the federal, non-federal cost share, whichever is established, which of course is 75% right now. There are provisions under 44 CFR for that to change, and that may happen in the future. Who knows?
Okay.
Yeah, I agree. Like in this case, hospitals that are making these bulk purchases for, PPE type items. I mean, they're not sitting there making it under the assumption that they're going to get reimbursed under the public assistance program. But if they're an eligible applicant at some point, they do. They would be subject to all the provisions,
Right.
notwithstanding, getting reimbursed by insurance, et cetera, et cetera.
Gotcha. But let's get into maybe other authorities as well. Good question here. Are there any authorities that would allow the president to enable state or even local governments to request assistance directly from military units or installations within their jurisdictions? My understanding, unless this has changed, is that under emergency conditions or emergency life property safety, there can be a direct request to a military unit to provide that. But everything else generally goes through the DCO channels and DCO FCO channels. Bill or David, comments on that?
Yeah, Glenn, this is Bill. Yeah, that's exactly right. If there's some imminent serious outside the post camper station gates that a commander can help his neighbors out, and plus there's mutual aid agreements, but major Title 10 that forces, regular forces will be provided through the Defense Coordinating Officer, the Federal Coordinating Officer, and up to that channel.
Yeah, I just add, in terms of that sort of immediate assistance that people talk about, that their jurisdictions relative to DoD installation, lots of jurisdictions have MOUs in place to provide immediate assistance or humanitarian aid. But again, short period, short leash under authority of the base or garrison commander to do those things. But if it's an extended mission, those are going to be subject, particularly in a national emergency, to higher authority, Secretary of Defense or NORTHCOM reviewing, that mission and what DoD's role is going to be. I would still encourage everybody to work through the resource requesting through, city to county to state emergency management to coordinate those actions if it's going to require a sustainment as opposed to a traffic accident outside the gate, for instance.
Gotcha. All right, thank you. Question here for Sarah, I believe. Under an 1135 waiver, could HIPAA be specifically waived to allow the release of COVID-19 positive negative results to allow for better public chain testing based on close contact while keeping HIPAA itself in place to prevent that privacy concern pushback?
That is a very good question, a bit beyond my specific expertise. I will say that there are other, I think there are other privacy rules that come into play that might implicate that as well as HIPAA. And we just found out today that the federal government allowed, hold on, I'm trying to find this in my notes here. They finally enacted some regulations that are going to allow for greater data sharing, something that's been sought after by the substance use disorder community as a potential barrier to getting information about people with substance use disorder, but it had been fought by privacy advocates. So I think that this is something that may help as well. If you want to contact me directly, I might be able to put you in touch with someone more HIPAA knowledgeable than I. And I don't know if my email is in the bio, but it's Somers, SOMERS @healthlaw.org.
Okay, Mr. Ronka, if you didn't get that full address, just type in a Q asking for her email address again as well. Kendra, I see a question from you. How can hospitals then verify the eligibility? It's a follow-up to the last answer. Unfortunately, my brain has lost the thread of that question. Could you type a little bit more about what you're looking for in regards to that question? I'm not sure if you need eligibility under Cat B reimbursement or under the some other authority. There's a question here, Bill, David, probably. What are the advantages of asking for a major declaration from a state?
Yeah, this is Bill, and David probably, he knows some of these authorities probably better than I do, but I've been thinking about crisis counseling and a lot of the individual assistance programs that they are asked for. I know a lot of the governors have already set up crisis counseling systems, but some of those costs will be reimbursable. David, there are several others, but you may help me out here.
Yeah, I think you have to look at, well, what is the unmet need, just like you do whether this was a fire, flood, hurricane, tornado, et cetera, is, what is it that the unmet need is? Is it people is it shortage of housing? We're not seeing like typical disaster, natural disaster, you'd see damage to infrastructure. That's pretty obvious. Homes damaged, people unable to live in their dwellings, mass care requirements, et cetera. So I think you have to look at what it is that you think you need. I mean, just asking for a major disaster declaration doesn't do a lot of good if the authorities in the Stafford Act, don't cover that particular situation. I think it's fair to say there's a lot of gray areas now in relation to how to apply certain provisions of the Stafford Act to a pandemic. But that aside, it goes back to being specific about if you're a local jurisdiction working with your state emergency management organization and talking about specifically what is it that you're trying to accomplish here before thinking that a major disaster declaration, if granted, would be a panacea or an easy button to fill. But some of the other programs Bill alluded to, in some of the provisions under what we call individual assistance to families and such may help offset some of the impacts. Many of the other things that you would expect are already available, and then we'll have to see how the unemployment, which is usually a big component of disaster assistance, how that plays out in the supplemental, that may be overcome by the supplemental funding being provided.
Yeah, two things, David, that came into mind. I was talking to Bob Penn about this the other day. They're under individual assistance that may help, or medical costs and burial costs that are associated with the individual assistance program if they're included in the declaration.
I would say the vast majority so far of the emergency response costs would be covered under Category B to the extent they're eligible. So you really have to figure out what specifically, again, I'll say specifically what problem are you trying to solve, and is there provisions of the Stafford Act that address that?
Let's continue with this question. How can hospitals verify their eligibility for reimbursement for their costs? I'm assuming under Cat B, but I'm not positive.
Can you repeat the question?
The question, how can hospitals verify their eligibility for reimbursement?
So a lot of hospitals aren't eligible, but to the extent they are, they should work, first I would, if you're local or regional, work with your county office or parish office of emergency services and or contact the state office of emergency services or state emergency management agency. It depends a lot on how the business of the hospital is constituted, whether it's for-profit, nonprofit, or if it's owned by, say, a county, part of a county healthcare system. There's also a lot of information available at FEMA.gov if you search through there in terms of fact sheets and program guides that are out there. And then I know some of the hospital associations, various state associations and local associations are putting out information about that. If you haven't talked to their intergovernmental or legislative affairs folks, I would encourage you to do that too as well.
Okay. Yeah, Deborah Salter is actually offering some great information as well. Maybe you can also, Deborah, share that request letter with NEMA, and then NEMA can get that out to the other state directors as a smart practice. Let me finish on this question for any panelists. What questions do you think governors should be asking their teams, their federal partners themselves about the authorities discussed today? Or what questions are still unanswered that we should be thinking about? Whoever would like to go first.
So this is Paul. There's a really excellent report from the Brennan Center on all of the potential emergency authorities. I don't pretend to be an expert on all of them or to know what a governor might need, but even for this relatively, my area is national security, so public health isn't my field, but even for me, I can see that things like giving the Secretary of HHS authority to allow the use of untested drugs might be something that governors would want to have the president to have in his back pocket now. So I would advocate going through that list, looking for things that you as experts in emergency management might see as relevant, and then the governors as a group saying, Mr. President, maybe this is something you should put in your back pocket now as a national emergency declaration.
Thank you, Paul.
Eileen, any thoughts?
Well, actually, I was going to recommend the Brenner Center report as well. I do think that's an excellent checklist, in particular to review it for all the authorities that currently exist that can be exercised by leadership. In addition to looking for the new authorities, look at the authorities that already exist that can be taken advantage of. I think in this environment, that's also a great way to get access to information, materials, and critical resources at this time.
Excellent, thank you. David or Bill?
Yeah, Glenn, this is Bill. I can't think of any other than, David's identified, he mentioned, looking at what the requirements are, whether it's crisis counseling or burial costs for folks who are having to take care of that sad duty, and then going through the Stafford and figuring out if that's what's authorized, and then include that in a request or supplemental request for in the declaration from the president.
Bill, sorry, Glenn, this is David. I think two things. One, decontamination is going to become a huge issue that we normally don't see in disasters. Public spaces, restrooms, correctional facilities, any place where you have, public spaces, normally that's just, not something you have to consider. That type of work should be covered under the current emergency declaration under Category B of the Public Assistance Program. But we're talking about work on a much larger scale here. So, that leads me to my second point. Really, is along those lines, you need to think ahead and anticipate what the needs might be going forward if this goes on for an extended period, and think a little bigger. What types of resources we might need that are probably going to be in short supply. Start articulating those requirements so that the federal government, can use these authorities to try to leverage, industry to create more capacity. A couple of weeks ago, some of the impacts that we're seeing might have been unimaginable to folks, but now that it's upon us, it's time to start thinking about what's the next step, that's unimaginable. Is it mass care? Is it, more decon, things of that nature? And what are the resources that are going to be required to do that, and start planning for that, to build that capacity now, rather than waiting, for another couple of weeks to go by.
Yeah, Glenn, this is Bill, and I hesitate to mention this, but if I were a governor, I'd probably be asking my AG and TAG, if we were to experience civil unrest associated with this in the long term, and I'm sure we all don't believe we will because of the nature of American people, but what are those authorities, and what assistance might we get from the federal government if we do experience that? I know in the planning, when I was with Craig in Florida, we were to hold back the National Guard from running the points of distribution, a certain percentage of them, for that very reason, if there was that difficulty in some part of the state.
Sarah, any thoughts?
No.
Okay, thank you. Well, I thank the panelists. I want to thank all the attendees and everybody for participating in this discussion. It's a tough time, but I'm confident in both us, our people, and our professionals to get through it. With that, I'll turn it back to Karen.
Thank you very much, Glenn. I appreciate that. Thank you to all of our speakers for sharing your expertise today. Thank you, Glenn, for your awesome moderation skills. And thank you to our great audience for participating. Take care, stay well. Thank you again for spending some of your valuable time with us today. That concludes our webinar, and have a good rest of your day.